And now, back to Louisiana Living.
Welcome to Therapy Thursdays on Louisiana Living. We are physical therapy and balance centers, and I'm Angela Yarborough, and this is Dr. Jerry Yarborough.
Hello.
September is National Fall Awareness Month, so we've been talking about falls and fall awareness and what Jerry has gone through, Dr. Jerry has gone through, and how important it is to not just live in that. We want you to love your life. The statistics show that every 11 seconds somebody falls, and every 19 minutes someone dies. You do not have to be that statistic. And that's what Dr. Jerry is going to talk to us about.
All right, thank you. So we don't want you to be a statistic. We want you to love your life, like Angela said. And today, we've been talking about balance and different causes of balance. As a physical therapist, we are going to look at someone with balance. What are the causes? It's not just, I got a balance problem. There's a lot of different systems that play into that. And we talked about that. We talked about strength, flexibility, whether it's your vestibular system, whether it's your somatosensory system, or is it your vision? All of those things play a big part. But today specifically, we're going to kind of differentiate the difference between dizziness and vertigo. Okay. Have you ever had any kind of dizziness?
I have, yes.
Yeah.
Miserable, yeah.
Yeah. And, dizziness is where you kind of feel lightheaded, you're just kind of unstable, you can even feel nauseated, and some of the causes of that can be, Angela's a nurse by trade, so dehydration can significantly cause some dizziness and make you really crazy. So dehydration is a possibility. It could be anxiety. A lot of people don't realize that they're even that anxious, but anxiety can even make you feel like you're having a heart attack. Again, as a nurse, Angela knows all that stuff. Dizziness can also be caused from the different systems we talked about telling your brain different things. So everything is just kind of unstable, or you would call that as an imbalance. So those are some of the causes of dizziness. It could be from medications. If you started taking a new medication and you started getting dizzy, you need to talk to your pharmacist and your primary care provider about that medicine and the symptoms that you're having, because dizziness is not a symptom that you want to just settle with, because it can cause you to have a fall, which can cause you to have more problems. So now the difference between dizziness is what we just talked about versus vertigo. Now vertigo is completely different. If your environment is spinning and you feel completely out of control, which I have felt that, I don't know if you have, it is scary, because you're just like in a dryer, spinning around. You have no control. So as a physical therapist here at Physical, we are trained to differentiate and determine the cause. Okay, there's certain maneuvers and treatments if you have vertigo that as a trained physical therapist, we're going to put you through to assess. So this is a model of your inner ear, and we got these 3 different canals here, and what causes vertigo most of the time, like 97% of the time, the cause of vertigo is what's called benign positional paroxysmal vertigo. BPPV, that's what we normally call it, because it's a big long word that even I have trouble saying sometimes. So anyway, the maneuver that we put you through will tell us where the debris is. Is it in the superior canals, in the horizontal canal, or the posterior canal? And the way that we know that is because your eyes are going to jump a certain way. They'll jump up and like to the right, or down and to the left, or they're going to go side to side. And all of that tells the trained therapist on how to treat you. That's why, if you have vertigo and you just start trying to treat yourself at home, that is not safe. You need to get to a physical location, all right? And we can help many times. If you come right when it happens, we can help immediately, and it can really make a big difference rather than going days or months with still having this problem. And one tool that we use here at our physical locations is called the infrared video oculography goggles. So we put these goggles on and it makes everything dark for you, and we can see your eyes in the computer as to which way they're moving, because sometimes it's hard to tell. So we'll video it and we can determine exactly where that debris is, which canal, and then that tells us the treatment that we do. You know, the Epley maneuver is very common, and lots of people want to try the Epley. Well, you may not be proper to do the Epley on, and you can actually make your symptoms worse. So if you have vertigo, give us a call at Physical in any of our 6 locations. Thank you.